Good afternoon and welcome to NTV. We are interrupting your normal broadcast to bring to you some well-researched information about today. Today is the 26th of June, and for those who are aware, it's the World Drug Day. And this day is recognized to raise awareness about drug abuse and illicit trafficking. So with me in studio, I have a panel of experts, and I will start with the ladies first. I have Sharon Nyambe, who is from the United Nations Office of Drugs and Crime. Drugs and Crime.
Yes.
Yes. You're welcome.
Thank you, Walter. Good afternoon, viewers. My name, I've already been introduced. Thank you.
All right. With me in studio as well is Rogers Kasirie, who is from the Uganda Youth Development Link.
Yes, sir.
You're welcome.
Thank you very much.
And online, we have Dr. Byama Mutamba. He's a senior consultant psychiatrist and head of alcohol and drug unit at Butabika National Mental Hospital. It's also a referral hospital, so for mental health, but also serves all the other general health issues. And we will be speaking to Tinka Zarugaba, who is the acting commissioner of police in the anti-narcotics department. So quite a wide panel, and for the next 1 hour, we're just going to be understanding why we need to know about drug abuse. It could be happening just right under your nose in your house, but you probably don't know that it's happening. Or maybe you know, you have some people who have been taken into rehab and you find it quite a challenge. Now, it's not any new thing. Just like any other places in the world, in Uganda, the use of alcohol and other substances during adolescence and early childhood, is a serious public health problem. The global burden of disease projected that tobacco and alcohol and illicit drugs were respectively the 2nd, 9th, and 20th leading cause of mortality globally. This report also, projects that tobacco smoking alone would lead to 1 billion deaths globally. Now, WHO has also, some statistics about drug and substance abuse, but I want to start with you, Sharon. First of all, let's understand what this day is about and why we have it. I won't say celebrated, but commemorated every year.
Okay. Thank you, Walter. Allow me to also introduce the organization that I work for. I know the viewers may be interested why
Yes.
UNODC, but it's very important for us to understand that within the UN family, UNODC has the mandate to make the world safer from drugs, organized crime, corruption, and of course terrorism. And we are the custodians of the 3 UN drug control conventions. And so it is drawn upon us to really respond to the world drug problem. And here in Uganda, we are privileged that within our program, we are focusing on youth crime prevention, and quite critical to youth crime prevention is the aspect of drug abuse prevention and treatment. I really want to focus back on your question. The International Day Against Drug Abuse and Illicit Trafficking, popularly known as the World Drug Day, is marked on the 26th of June every year, and primarily to draw strength and action and bridge cooperation around our goal of achieving a world that is free from drug abuse. So every year we come together to commemorate this day and create the necessary awareness around the issues affecting drug abuse in different societies, but also the illicit drug trade. The theme, if you allow me.
Yes, please go ahead.
The theme for this year is share facts on drugs and save lives. I know people may be wondering why did we choose this theme? But our research and policy analysis department have really come across some very challenging statistics. Just last year in 2020, 275 million people used drugs globally. Out of these 275 million people, 36 million suffered from drug use disorders. This is a problem. Young people are at risk of their health, and we're stealing their futures. And just to draw on 2019, over 500,000 people died from drug use only. So it's a problem. We need to share information. We need to demystify the myths that are associated with drug use, and that is why this day is very important.
Okay, I'm very sure the day also takes into context the kinds of drugs, because when we speak about drugs, people may actually think we only, mean, for example, nicotine, cocaine, and that stuff, but pharmaceuticals are also drugs and can be abused.
Absolutely.
I know for sure there's a report that was produced from Nigeria and I think South Africa, where a drug called codeine is being abused in those two countries. I'm sure there must be other countries that are facing the challenge of the same drug. But where is the biggest challenge?
Thank you. So viewers listen to the few statistics that I gave.
Yeah.
But it's also important for me to share that yesterday, one of our mandates as UNODC, annually through our research and analysis department, we launch what we call the World Drug Report every year. So this informs member states on the current trends around illicit trafficking and drug use. So what we are seeing, Walter, is that globally, there's been an increase in the use of cannabis, more so during the pandemic period. However, what people don't know is that the potency has also increased. We are seeing, for instance, in America, that the potency of cannabis has increased or has quadrupled and doubled in Europe. Now the problem is, while we are seeing this trajectory of cannabis use on the increase, the perception among young people on the harm that cannabis brings is actually reducing, and it's recorded at 40%. So you see there's a disconnect. So while drug traffickers are giving the perception that this drug is actually harmless, and young people are buying into it, and by the way, cannabis is the drug that's commonly used, it's accessible, widely grown, so it's usually the stepping stone for most young people to hard drugs. So that is a problem. And so we are also seeing that non-medical use of pharmaceutical drugs, as you put it, is on the increase. That is also problematic. And I think it's very important for regulators to pay more attention to what is happening, especially in this COVID pandemic period, where access to pharmaceutical products may not be well regulated. And I know we have experts online who can speak more to that.
Yeah. All right, thank you very much, Sharon. I'll move to Rogers.
Yes, sir.
What are your experiences on the data and evidence about drugs and drug use in Uganda, especially on the vulnerable groups, young people, and people living in the urban slums?
Okay, thank you, Walter. Our work centers in the slums, in Kampala, in Wakiso, and in Mukono. We receive many young people who come to our drop-in center. For example, in KCC in Kampala City Council alone, we operate 9 centers in the ghetto areas. We receive many young people who come. For example, out of every 10 young people we receive, 4 have tried and tested drugs, but 2 continue using. 4 may test, the 2 drop off, but the 2 continue. And that keeps on worrying. When you ask them which particular section of young people really are using drugs, even the age is going younger. The age is going younger. We are getting testimonies from young people who are like 12 years. In terms of gender, boys use more drugs than girls. Of course, the girls are using more alcohol. But in terms of drugs, we see most of the young people using a lot of cannabis, and that is a cause for worry. Apart from cannabis, there are people also reporting that they have seen people who are using heroin, and they are using what? Cocaine. Now, what does it tell us? It is telling us that the problem is here in Kampala. We can no longer imagine that the problem is away from us. The problem is here. Now, there are also other scenarios which you have seen in the slums where young people are involved in drugs. Especially have young people who have been, involved in karaoke groups. Young people who end up, dancing in bars, getting naked. When you begin to talk to these young people, they tell you that you cannot do these things when you are sober, when you are normal. Many of them have been introduced to drugs. Also, the young people who are involved in transactional sex, particularly this hard time. In order to go through the relief, the pain, the stress which goes with it, drugs have to be used. I've also heard of situations where women get naked and they're using pipes. And to do that, there has to be a psychoactive substance. There has to be a substance, drugs. We've had young women here who think they can get, a lot of fortunes if they go and smoke pipes. And what do we see? In order for you to do that, they're introduced to cannabis, they're introduced to hashish, they're introduced to marijuana. Marijuana is put in and they smoke, and whoever is doing that gets a lot of money. Also in schools, there are reports in schools. Some schools, not all schools are using drugs. There are some few cases in schools where young people are reporting to be using marijuana, to be using kube, to be using kat, mairunji. We are also told that the others who are using pharmaceutical drugs. Actually, there's a problem now we see of self-medication. Self-medication. And this is one of the problems which has risen with COVID. As we shall share with you, even during COVID time, marijuana use has gone up in this country. She has said that the potency, the strength of cannabis has really changed and has grown stronger and stronger. There's no scientific evidence, the doctors will tell us, to prove that cannabis will cure COVID. No scientific evidence. WHO, Minister of Health has said, do not touch. Because this is an addictive substance. The moment you try it, you get hooked to it. So in the younger people, the problem is there. I think what this day is telling us that let's do a self-reflection. Where are our efforts going? Are we keeping young people safe? Are we keeping young people healthy? That's why this day is very important, that we need to inform our people. Even when COVID is there, we don't want people to get COVID at the same time come up with mental health related problems arising out of using cannabis.
Okay. As we prepare to speak to Dr. Biama, I would like to hear from you. Have you carried out some sort of study during this pandemic to establish if there's actually an increase or a rise of people using drugs or a decrease? What is it like outside there?
In our population, when I talk about young people, the use of cannabis, use of drugs is going up. The problem may not be out of hand, but the problem is going up. Because I've told you that out of every 10 young people who come to our center, 4 confess to have used either cannabis, they confess that they have even tried intravenous, heroin and cocaine. Others confess to be chewing kat and mairunji, but also inhaling fuel, gas, paint thinner, gas and petrol. You see many young people on the streets who are, inhaling. And that is also a problem for worry. But the biggest problem we see among our young people is cannabis and hashish.
Let's hear from Dr. Biama Mutamba. He's a senior consultant psychiatrist and the head of alcohol and drug unit at Butarika National Referral Hospital. Doctor, if you can hear us, I'm being let know that he still has some sound issues, but let's continue. We will have him cut in whenever he's ready. But Sharon, when the World Report is launched, of course there are several recommendations. But I don't know, with your expertise from Uganda, because we'd like to hear recommendations that fit us as a country or suit Uganda as a country. What exactly are we supposed to be doing to change this trend?
Thank you very much, Walter. One thing I wanted to draw from the last conversation was that if we're learning anything from COVID, is that science and trusting in science actually saves lives. And that's why we are here sharing the facts, because we believe that once people are informed, they make better decisions. So there are some key highlights that are coming from the World Drug Report. I already made reference to the increase in use of cannabis and the potency. What we are also seeing is that as a policy guidance from the report around this issue, we are encouraging that we need to combat misinformation. We need to raise awareness, and we need to invest in research that is based on the Ugandan context, but gives us information on what is the harmful, what are the effects when you use cannabis. Are there any medicinal benefits to it, so that you give people information and they make better decisions. But we also think that for drug use prevention, it's very important within this COVID time that efforts targeting drug use prevention and treatment are integrated within the overall national COVID response. It's very important. What we are also seeing from the report, Walter, is that there's an increase of drug sales on the dark web. That is a problem. When we are all at home and we don't have access to socialization, people are interfacing with the internet. The dark web market for drug trafficking it just emerged 10 years ago. But already it is worth $315 million. And that's just a small fraction of the global drug market. So we need to invest in our law enforcement. Are they well equipped to address drug trafficking on the internet? Do they have the expertise to crack down on some of these global markets? How are we dealing with cryptocurrency markets? Are we monitoring our electronic payments? Are we linking them to illicit financial flows that link to drug trafficking? That is also another issue. But we've also learned that you may have expected drug traffickers to have seen a downward trend in their markets, but they've improved. They've become more innovative, and it's problematic for us. But the long-term effects post-COVID, the socio-economic impacts, are already showing us that for Africa, it is projected that 40% is going to be the growth in drug use on the continent. What does that mean for us? We have a young population. The population is projected to grow, but drug use is projected to grow at 40%. Are we ready? Do we have sustainable solutions to support young people, empower them, divert them from drug use, and give them alternative economic opportunities? Do we have the systems? So we need to think in more detail what this means. And also, because the post-COVID economic crisis is also bringing that vulnerability in households, we are seeing a trajectory where drug cultivation and drug trafficking will grow. And we're going to have, as my colleague mentioned, the stress related to the pandemic and the vulnerability will lead to the increase of drug abuse. So we have situations, but we need to start working collaboratively, because this is a multifaceted problem, and we all need to work together to address it.
Okay. All right. If you have just joined us, we are speaking World Drug Day, and of course this is meant to raise awareness about illicit use of drugs and trafficking. I have with me in studio Sharon Nyambe from the UN Office of Drugs and Crime, and in studio with us is Rogers Kasirye from Uganda Youth Development Link. We have Dr. Byama Mutamba from Butabika Hospital online, and Mr. Tinka Zarugaba, the Acting Commissioner of Police in the Anti-Narcotics Department. Now, we will be hearing from the people online, especially the police, because Sharon here raises a very important factor on stopping or curbing illicit use and trafficking of drugs. But let's hear from Rogers. When we talk about drug use, probably we're underestimating the impact. But what is the impact on the population?
True, there is an underestimation of the problem of drug abuse. Particularly when you look at the health side, and given that Uganda is a younger population, And science is telling us that young people are still growing up. The moment they begin using drugs, ingesting drugs, administering drugs, their mental is going to be affected because they are still developing. They are still developing cognitively. They are still developing social interaction skills, their language and everything. Anything which disrupts normal growth, you begin to see it in schools when students begin to perform poorly, when you begin to see strikes, when you begin to see violence, when you begin to see one school attacking another school, fighting. And all those growths, normal growths, are interrupted when drugs come in. But apart from that, we begin to see a lot of criminality associated with drugs. Criminality is a very big problem here, and the government spends a lot of money. But here, I think the report is reminding us that we can do more in terms of prevention. And then we'll cut the cost which is spent on enforcing and dealing with drug abuse and divert it to education or other programs. The other issues we see, particularly for young people who are abusing drugs, is that where will they be employed? We begin to see mental breakdown, as the doctor will share with us from Butabika Hospital. Young people are being admitted in hospitals at a very early age. Now, where will they go? What will happen if they grow up? I think the message is becoming very clear that drugs disrupt the normal growth of young people. Drugs can escalate criminality and can also escalate violence. We are told that some of the people who commit heinous crimes to do with rape, some of the people who kill others, there is a drug behind. There is a drug abuse behind. And that's why we talk about it. In a friendly way, we are not here to scare people, but to give the facts. That's why the UN team is very, very correct. Let's give the fact that the facts are here. Will Uganda be able to manage if there is a spike in drug abuse, like COVID? That's why it comes in very central that now begin to address the issue of drug abuse. We don't want to see people who are stealing at home. You see, when drug abuse is introduced in a home, the family gets disorganized. First of all, the young person gets disorganized. It disorganizes the whole family. The dad cannot work. The mom cannot work. They begin to blame each other. And the community even begin to stigmatize the family. It's better that we protect, we prevent, because the impact is so great that unless even the cost of treatment, the cost of counseling, the support mechanism you need to help one individual child is very expensive for the family and expensive for the country. So the impact is very great that it's better to prevent the problem than allowing the problem to spread. I know there are people who are fueling this. Smoke, you can be safe, you can be what? It's not easy. Science is telling us it's better not to try than trying that will stop. Many people who have tried, they cannot stop. We see many of them in our community. The young person who was doing well from universities, they come to us, they go for treatment. Young people have dropped out of schools and parents get, the whole family even get dismantled when drug abuse is introduced in the family.
You raise an important issue that I will put to the police officer, Tinka Zarugaba. Mr. Tinka, if you can hear us, the issue here is, are we able to manage as a country the problem of drug abuse? And this includes illicit trade. Are we able to manage as a country?
As I've been introduced, I'm Tinka Zarugaba, Marketing Commissioner, Anti-Narcotics. Uganda is prepared for the drug problem, but from the onset, I must say that we are seeing drug abuse, illicit trade in drugs increasing. As of now, we estimate that the youth in Kampala, 14% are using different types of drugs, and the trend is increasing. We are managing, for example, we have the Anti-Narcotics Act, which was enacted in 2016. It's a very good, severe act. If it was implemented to the latter, the only challenge we have is that it requires a lot of regulations, which both the Ministry of Internal Affairs and the Ministry of Health are drafting. Once those regulations are already, we are going to begin head on to ensure that the abuse of drugs in Uganda is scaled down. Secondly, we have a robust anti-narcotics department. We have trained our police officers. We have distributed them mainly to the entry and exit points of the country so that we can have drug abuse checked. So I can assure the country that even though the problem is growing, but we are ready to face the challenges it brings.
And crime report. What are the statistics from the police and crime report in terms of drug abuse and trafficking?
According to, if I can give 3 statistics from 2018, we are seeing drug abuse on increase. In 2018, we would arrest 1,500, but now we have moved to arresting about 2,850 from the statistics of last year. So you can see that there is a steady increase. I must say that the statistics that an annual report of the police may not reflect the true picture of what is happening in the country. We may be arresting fewer than the people who are involved in crime because of other, could be logistical challenges, could be manpower challenges, could be what, but we are still rebuilding our capacity as anti-narcotics so that we can ensure that we are on top of the game of ensuring that Uganda becomes a free drug country.
Okay, thank you very much, Zarugaba. He's the Acting Commissioner of Police in the Department of Anti-Narcotics. Now, we are going to take a very short break, but when we return, the panelists are still with us, and we will also try to hear from Dr. Byama. It is important because we need to hear the impact of drug abuse, especially on the psychological effect, but also the health of the population as regards the effect of drug abuse. So we will come back very shortly. Stay tuned and don't go away. Welcome back, and thank you for staying with us. We are still discussing the World Drug Day, and this is to raise awareness about drug use, drug abuse, and illicit trade or trafficking of drugs. We've had discussions from Sharon Nyambe, from the head office, the UN Office of Drug and Crimes. And we have also heard from Mr. Kasirie, Rogers Kasirie of Uganda Youth Development Link. But now I want us to straight go to Dr. Mutamba, Senior Consultant Psychiatrist at Butabika Hospital. And Doctor, we've been trying to connect to you, but now we are very happy that you're with us. We want to understand the statistics from your side. What is it like as regards drug abuse?
Good evening, Walter. I hope you can hear me.
Yes, we can hear you.
Good evening to the panelists and the viewer.
All right, the internet seems to be very unstable. Yes.
Oh, we've noted that mind drugs. Sorry, can I continue?
Yes, you can go ahead.
Yes, so I was saying that over the last year, our data from the hospital shows that we've had a substantial increase in the numbers of people using mind-altering drugs. And that is, like was mentioned in the studio. And this has been associated, of course, with the pandemic that we are in, the stresses associated. But what is really eye-catching, especially with reference to this day that we are commemorating, is that about half of these individuals are the young people. That is between 18 to 30 years, where we have almost about 45% of individuals that account for admissions and attendance of outpatient care. And so that is worrying.
All right. Dr. Mutamba, we will be connecting to you again. Your internet is very unstable. It's very unfortunate that we can't hear from you very well, but we will try other means to see that we can, hear what is being done at Butawika, especially as regards the effect on the population. But let's talk to Mr. Tinka Zarugaba to try and understand what the law says about drug use and trafficking.
Thank you, Walter. As I mentioned earlier, that we have a good law. The law is very stringent in that if you are got in possession of drugs, whether you have 1 leaf of cannabis, whether you have 10 kilograms of cocaine, if that drug is intended for use, the law criminalizes that, and the punishment is 10 years in imprisonment or a fine of 10 million. The law criminalizes trafficking, that is selling, illegal manufacture, transportation, etc. So if you are got trafficking narcotic drugs, the law, when you are convicted, you are supposed to be sentenced to life imprisonment, and you are also supposed to pay a fine of 10 million. The law also gives us powers to confiscate any property that has been suspected to have been acquired from the proceeds of crime. The law also criminalizes the growing of narcotic crops. That is, in the case of Uganda, cannabis and cat. You only have to grow if you have the license from the Minister of Health. The same law also, it does not only look at criminalizing and punishment. The law establishes rehabilitation centers and mandates the Ministry of Health to establish and fund rehabilitation centers. And also those who are in private practice must be regulated by the Ministry of Health. So briefly, that's what I can speak on the law. But as I have told you, that this law requires regulations on growing of narcotic crops, on licensing, on establishment of rehabilitation centers, and also on establishment of the Narcotics Coordinating Committee, a body which is supposed to make policies and guide the government on how to ensure that narcotics are administered in Uganda. As I've noted, that some of these issues have not yet been addressed, but the concerned people are in the process of addressing them so that we can have all the regulations that we need. Then we can implement the law to the letter.
Of the law to the letter, that's something that we can leave to the police. But also, we do understand that Uganda for a very, very long time has been used as a conduit for drug trafficking. And, this has facts to it. We have very, very loose borders that, allow the proliferation of drugs in and out of the country, which is probably the reason why we have access to these drugs here in the country. How successful has the police been in trying to, first of all, stop or curtail, but also prosecute those people who have been found in such activities?
Recording in progress.
I must agree with you that Uganda for some good time has acted as a transit route for hard drugs from the origin countries to the consuming countries. And the reasons were basically 3 or 2. One, Uganda has the connectivity of international flights that come from Uganda were so easy for drug traffickers. Drug traffickers need quick transport to reach their destination. And the Entebbe airport was one of the hubs that was seen as good to reach the destination. Secondly, Uganda, as you have noted, has a porous borders. We have Lake Victoria, which is very difficult to man. We have land points. Some of them are the entry and exit of these points are not gazetted, and our officers cannot reach on every hidden corner to ensure who is to see who is exiting or coming in. The third and the most important factor why Uganda became a transit was other regional countries were toughening the Anti-Narcotics Act. Uganda became slow. For example, in Kenya, if you, as early as 2012, if you were caught growing cannabis, you had to lose land to the government. In Tanzania, the law was very tough. So the traffickers that were in Tanzania had to shift, and Kenya had to shift and use Uganda. To your question, what have we done? We have prosecuted very many people and prominent ones. If I can give you an example, there are even some of them with our partners. You remember, for example, if you are caught trafficking drugs from Uganda to other countries, for example, USA, you can be charged and tried in US. We have some people who have extradited and they are answering charges in US. Even here in Uganda, we have some people we have prominent, we have prosecuted. The only challenge we have is that we have not been able to confiscate the property of the traffickers. The reason is simple. Our act says that there must be regulations made by the Narcotics Coordinating Committee for us to begin confiscating. And that committee is not yet in place, so we cannot seize property. But as for prosecution and conviction, our statistics from annual crime report speak volumes of our work.
Just to add on that, what I understand that this is in a business that is headed by very powerful cartels. And in most cases, the persons that are actually arrested running around with these drugs are not the ones financing the movement of drugs. And when such arrests are made, and probably these people are charged in court, it basically doesn't take away the fact that this guy is going to hire another person to move the drugs around. How do we deal with such a situation?
The anti-narcotics police worldwide, we are interlinked. We coordinate and cooperate with, for example, Eurocop, that is the European police. We cooperate and coordinate with the anti-narcotics police of Nigeria, and our biggest challenge is the Nigeria. So even if we got what is in Nigeria, we share information of our facts with whatever police organization of where we think the kingpin, the organizer of the business is, and he is arrested from there. We share evidence we have with them, and they are tried. So we have been good at interlinking ourselves. Where need be, we extradite these people, but the extraditions have been very minimal because it takes a lot of process. So what we have resolved as anti-narcotics officers, worldwide is that let us share information, let us share facts, let us share evidence, so that if I have a suspect, for example, arrested in Uganda for trafficking of narcotics, but the link is taking me to, for example, Brazil, where the drugs are originating, can I share that one with the Brazilian police and share the evidence through legal means, through legal channels, and the Brazilian police will follow up with the person who is there and get him arrested and prosecuted in their home country. So that's why currently we are using.
Okay, thank you very much for your time. Tinka Zarugaba, the Commissioner, Acting Commissioner of Police in the Anti-Narcotics Department. We're basically running out of time. We have about 15 minutes to go, and I'll take the discussion back to studio as we try to connect to Dr. Mutamba, if technology allows us to do so. But Sharon, the issue of dealing with drug trafficking and, you know, drug use, what interventions do we need to do as a country to help the young people? Because the statistics are increasingly showing that the young people are most affected. And that also putting in mind that we are in a situation where we can't meet physically, so it's quite challenging.
Thank you, Walter. I think it's very important for us to, again, raise awareness. And we have to take advantage. Of course, one positive aspect that came out of COVID is that innovatively, in terms of drug prevention and treatment, we managed to use technology to not only reach people, but also to provide services. I think governments should invest a bit more in these systems. We really need to reach the young ones. We need to provide the right information. And in terms of our response in country, we've looked inward, the UN system. And because UNODC is responsible for youth crime prevention, we went and sat down with our sister agency, UNDP, which really invests on issues relating to youth empowerment. And together we've partnered with the Ministry of Education and Sport and the Uganda Youth Development Link on a project that's looking at youth crime prevention through sport, art and culture, focusing on the hard-to-reach youth. Yes, some young people are privileged to have access to the internet and of course television, but there are those hard-to-reach youth in slum areas in the community that make it very difficult for them to access this information. And this work is targeting those young people because, as we've already learned, young people, when we do not invest in their development and their health, we do interface with another problem of HIV. Drug use links to HIV. It's a high risk for HIV infection. And we also know that drug users are hardest hit with HIV. And so it's very important for us to inform young people that there are so many associated risks to drug use. Your future is stolen, but also in terms of your own health, and also aspects relating to the risk of acquiring HIV are quite high. So I would really state on two aspects: demystifying the myths associated with drug use, combating misinformation, but also investing in awareness.
Okay. All right, thank you very much. Let's connect to Dr. Mutamba quickly on the phone. Dr. Mutamba, you were earlier giving us statistics from Butabeka Hospital, but as you also continue with that, we would like to know, what you find out as the trigger or the driver for continued drug use from the people that you have seen at the hospital.
Thank you, Walter. You can hear me?
Yes, doctor, we can hear you.
Okay. Just about the technology. So as I was saying, the majority of the individuals that we see are the young people between 15 to 30. And over the last indications that this COVID pandemic has resulted in an increase in drug use of all kinds. And this is definitely a problem. It's also important to note that drug use is associated with a lot of other conditions. And I heard Sharon mention HIV and infectious diseases, as well as mental health problems. And mental health problems are commonly a trigger for using substances, as well as a lot of stressors in people's lives. Some people are more vulnerable, as you said, genetically predisposed, right from like the genetic inheritance in their family. But this usually has to go hand in hand with circumstances in their environment, whether it is right from their childhood, a lot of adversity or childhood trauma, and then as we grow up, we face a lot of challenges, and that's where misinformation comes in, peer influence comes in. Now with a lot of unregulated information on the internet, that is a big source for drug use and for actually assisting drug use, and that has created a problem because that actually even informs the young people about what kind of drug to use, just so that they can start and also continue using the drug. So the triggers are various. I think what is important is that for every individual, there's a story behind their drug use. And it is important that they reach out to the right help so that they can understand why they happen to be the ones with a drug use problem and how they can be helped. I think that's what I can say in a nutshell.
Okay, quickly, Doctor, I want you to also tell us, because you've dealt with these people, what kind of burden does drug use, impose on, first of all, the person who is using drugs, but also their family, social life, and general well-being?
Yes. So drug use primarily affects the individual, but it also affects the family around them. And because it's an ongoing problem, and it results into a lot of health problems, both mental and physical, social problems, whether it's workplace, whether it is school, whether it is relationships. It results a lot into crime and other problem behaviors in society. And so it cuts across all strata of society. And that's what makes it a definition of a drug use problem. That someone continues to use these drugs in spite of the problems that it is causing them, in a way that they've been taken control of this drug. And so these problems keep on multiplying, and I think Rogers was mentioning it, that in the end it takes its toll, not only on the individual, but the family and the community. And the challenge is that it is in the shadows. Everyone wants to keep it away. Stigma is what drives it, and therefore people only present for help when there is a crisis. I think we need to think about how can we recognize this at an early stage, help people to get early treatment, and therefore stop it before it becomes too late.
For that brief on drug abuse, we're grateful to connect you over the phone. And I must say that with just a few minutes, we will not be able to, have you back, as well as Tinka Zarugawa. At this point, I will let Rogers here give us, his parting shot, but in terms of what we need to do for the future.
Okay. Allow me to briefly put this off. There are 3-4 things I want to raise. One, that Uganda is not Uganda is not in the problem. Now that we don't have a big drug problem, but we need to take action. The second point I want to raise to our viewer is that children are easy to help, and children are malleable. If we give them the right information, the right message, many of them will not start drug abuse, like we did for tobacco. And I think we can do it also for drug abuse. Let the message of awareness, prevention go on. The third thing is that we need, as parents, as families, we need to be cognizant of what is happening to this young man. Why has the young man changed over a very short time? Is he glorifying, glamorizing drug abuse? People who use drugs, people begin to investigate the paraphernalia, the pictures he put there. Is he violent? Does he change suddenly? And the eyes are red and want to get out? It's very important to take note of that. Then the last thing is that we are proud of the United Nations Office on Drug and Crime. Even if you don't come and talk to her, you can visit their website. there's a lot of intervention, there are a lot of methods, there is a lot of messages you can get. Whether you are in schools, there are materials for people working in schools, there are materials who are working in communities, which you can take advantage of without even paying a coin. There are also trainings going on currently online and globally, which we can source from UNODC, and our people can be better. Of course, even they are working with the Ministry of Education on Live On Lulu program, the sports program, which is helping young people, and they are introducing messages. And we should be proud of them, and this helps a lot. Thank you very much.
All right, thank you very much. Sharon, I'll give you just about a minute or two to, let us know what we need to do for the future as we conclude.
Thank you, Walter, and I'm really grateful for the different experts, and they've brought this problem down home to Uganda. From a global perspective, we are worried. The World Drug Report is saying it is projected by 2030 that drug use in Africa will grow by 40%. That is something that we should all be worried about. We have a young population. What does that mean? We need to invest now in young people, alternatives. We need to look at how are we working and managing this drug problem on the continent. For us in Uganda, we need to monitor the trends, and I'm very happy that the narcotics department is really doing a good job, and they are ready. Because we need to monitor what are the trends, how should we look at sustainable systems. And we're in a pandemic. So already, this is a trigger for socioeconomic problems. This is being taken advantage of by drug traffickers. They've changed the game, they've become more innovative, they're using shipment, private aircrafts. They are finding means and ways to send their products out in the market and more accessible. So we need to invest in our law enforcement and ensure that they have the right tools and skill sets to respond to this growing problem. But because drug traffickers are also taking advantage in terms of growing due to the vulnerability that is existing to the pandemic, people have lost jobs and so on, we need to invest in drug treatment and also prevention in a COVID-19 post-recovery plan. We need to look at these vulnerable communities and what this has meant and the link to drug use. We need to save the population. We need to change the narrative.
Thank you very much. Sharon Nyambe there concluding. She is from the head office of the UN Office of Drug and Crime. We also had Dr. Byama Mutamba, senior consultant psychiatrist at Butabika Hospital, and Tinka Zarugaba, the acting commissioner of police in the anti-narcotics department. We also had Rogers Kasirie, who is from the Uganda Youth Development Link, and myself, Walter Mwesije. This has been a very good discussion, and one thing that you ought to pick from it is don't be used as a conduit to deliver drugs to somebody, but use the opportunity that you have to report and stop the cartel. My name is Walter Mwesije. We will leave you at this point. Thank you for being a very good audience. Good afternoon.